A 28-year-old man comes to the office with a 2-day history of yellowing of the eyes and dark urine. He reports that his brother has had similar episodes in the past, but not his sister. Current medications include primaquine, which we began 2 days ago in preparation for an upcoming trip. On physical examination, there is mild conjunctival pallor and scleral icterus. There is no palpable lymphadenopathy or organomegaly. Laboratory studies show hemoglobin of 12 grams per deciliter and hematocrit of 36%. Decreased levels of which of the following is most likely in this patient? Go ahead, pause the video, and try the question yourself before we go and talk about the solution. So before we talk about the solution, it's important that we understand a couple of metabolic processes. The first is what's called the HMP shunt, in which glucose 6-phosphate is converted into 6-phosphogluconolactone, which ultimately creates ribose 5-phosphate to be used in the synthesis of nucleotides. The enzyme that catalyzes this is glucose 6-phosphate dehydrogenase. Glucose 6-phosphate dehydrogenase in this conversion also generates a molecule of NADPH, which is important in the conversion of reduced or oxidized glutathione into reduced glutathione via the enzyme glutathione reductase. NADPH will then be oxidized into NAD+, but glutathione becomes reduced. Reduced glutathione is important in ensuring that oxidative stress is reduced in the body because it converts H2O2 into H2O and ensuring that reactive oxygen species are not damaging the cellular processes in the body. And the enzyme that catalyzes this is glutathione peroxidase. People can sometimes have deficiencies in glucose 6-phosphate dehydrogenase. In fact, this is the most common enzymatic deficiency in a patient. And the reason why, and this is inherited in an X-linked recessive manner. Additionally, patients with glucose 6-phosphate dehydrogenase deficiency, in conditions in which there is an increased amount of oxidative stress, such as the administration of flavabines, sulfonamides, nitrofurantoin, primaquine, chloroquine, and other anti-tuberculosis medications, then they experience hemolytic anemia. Additionally, on peripheral blood smears, since there's hemolytic anemia, the red blood cells will look abnormal, and you will see the presence of Bite cells and Heinz bodies. Now that we understand what glucose 6-phosphate dehydrogenase deficiency is, let's go back to the vignette. So here we have a patient with yellowing of the eyes and dark urine, which is secondary to the administration of primaquine, which is an antimalarial medication. This medication increases oxidative stress in the body. The yellowing of the eyes is consistent with bilirubin as a breakdown product of hemoglobin inside red blood cells, and the dark urine is consistent with hemoglobin in the urine. Increase the levels of bilirubin would also explain the conjunctival pallor and scleral icterus. This patient is anemic as the hemoglobin is less than 13.5. This patient very likely has glucose 6-phosphate dehydrogenase deficiency, which is characterized by an inability to produce NADPH in order to catalyze the reduction of glutathione. Answer choice A is incorrect because free radicals are increased because there's an increased amount of oxidative stress when the body is unable to produce glutathione. Galactose 1-phosphate. So this is not a problem with galactose metabolism. Patients with galactose metabolism disorders often experience other symptoms such as cataracts, poor feeding, failure to thrive, and neurological defects, which is not consistent with the vignette. Pyruvate would be decreased in somebody who has, for instance, a different inborn error of metabolism, such as pyruvate dehydrogenase deficiency, but this would present earlier in life. In patients who have reduced tyrosine, experience phenylketonuria, which is characterized by other neurological defects, as well as a musty body odor, and this is a problem with catecholamine synthesis in the adrenal medulla, and this is not consistent with our clinical picture. So by process of elimination, this patient has a glucose 6-phosphate dehydrogenase deficiency and is experiencing hemolytic anemia secondary to the administration of primaquine.